Hello, everyone. I'm Sheldon Barlat-Rumer, and this is it. Welcome back to This Is It TV. It is always a pleasure, and I'm always so excited to learn so much more with our next guest. I'd love for him to reintroduce himself, his first and last name, and all he's up to.
Sheldon, I'm Louis Bezich, men's health advocate, contributing writer, thephillyvoice.com, and of course, the author of Crack the Code, 10 proven secrets that motivate healthy behavior and inspire fulfillment in men over 50. Great to see you.
Great to see you. You guys, you know, we cheat a little bit. I always love to chat with my dear friend before we hit record, and I'm super excited about this one. What are we talking about today?
Well, I've got to get back on my soapbox, Sheldon, because, you know, as much as we advocate for men's health and the health of men and women of all ages, just recently in July of this year, the Commonwealth Fund, one of my go-to organizations for good, solid data analytics and tracking of health trends, unfortunately reports that, you know, it's more of the same. Yeah. While we've got advances in all aspects of life, we use data analytics to drive our decision-making in sports games. You know, artificial intelligence can, you know, have computers do the work of humans. When it comes to men's health, we're still in the dark ages. We're in the past, and it's ridiculous. And this report points it out. So here are the specifics. Yeah. Men are sicker and die younger in the United States versus other countries. American men that were compared with others in other industrialized countries are have among the highest rates of avoidable deaths, chronic conditions, and mental health needs. And in America, 29% of the men have multiple chronic illnesses, where in Australia it's at 25%, in France and Norway it's 17%. So the numbers tell the story. When you compare the health of American men to those in other industrialized countries, we lose. And we don't like to lose.
And we don't like to lose. We shouldn't lose, especially with all of these resources and capabilities. We should not be, you know, reading the numbers that we're reading. I'm sure it's not one thing that contributes to this. What are your thoughts on where we've gone wrong and how we can fix it?
Number one, let me just be clear. You know, I'm in healthcare, and we have America has by far the best healthcare in the world. And we spend more by far than any other nation in the world on healthcare. Yeah. The problem is that the outcomes, the health of our people are, when you compare to other countries, are middle of the pack at best. So we're behind all these other countries, yet we spend so much more. So, you know, what I've concluded and what's at the foundation of my advocacy is that it's more than medicine. It's our lifestyle, and it's the behavior, our own behavior, that influences that lifestyle has the greatest impact on our health.
I agree. I mean, listen, we can have the greatest health systems, the greatest medicine, the resources even, and access to that medicine and to that healthcare. But if we are not willing to change our lifestyle or make adjustments to live a healthier, better life, then it doesn't matter what's available to us if we don't take advantage of it, right?
Right. Now, it's not easy. We keep saying that, you know. Our healthcare system is not perfect in terms of getting appointments. Yes, there are genetic factors that, you know, impact us, economic factors. We know that in underserved communities, it's hard with food deserts and such. But all that aside, what I have found in my research of 50 plus men is that it's all about what I call the end game. It's the motivation that comes from wanting to dance with your daughter at her wedding, wanting to travel with your spouse, second careers. It's those emotional and personal aspirations that really is the driver. And the men that I studied, that's what, you know, they were all about. Health is a means to an end. It's that end game that drives us. So I think we need to shift from sort of the natural sciences of biology and chemistry that is behind medicine and shift to the social sciences, the psychology and the social factors that really can drive those motivations, because that's what will keep us healthy.
Agreed. Because all of the information in the world without the motivation and the action steps is going to really leave us just wanting to be healthier, but not being, you know, changing anything within our day to day. And what you've done so well in all of the conversations that we've had is really provide these practical ways to get yourself closer to, again, dancing in a healthy way with your daughter, going on vacation, reconnecting with family, and being those motivating factors that can help you in having a benchmark to living a healthier life. And so if somebody's at that point, right, you're over 50, you're a man, you're sitting in the space being like, I know I can feel better. Where do you think people should start? Like reading these statistics, knowing that this is wrong, but maybe still feeling a little overwhelmed.
Well, what I tell men and the women and others that love them is that start with your social platform. What I mean is before you do the gym membership, before you buy the running shoes, think about what's most important in your life.
Right.
In my case, I know I have a 6 going on 7-year-old grandson. I want to be at his college graduation.
Yes.
I want to see him grow and experience things with him. And the common denominator to all of that, I've got to be around to do it. I've got to be healthy enough to be active with him. So once you understand sort of what's at stake, then, there's plenty of diets, there's plenty of exercise routines, there's plenty of gyms out there, there's books, there's so much out there that you can then craft what you want. And again, look at my articles on Philly Voice, read Crack the Code. You'll get some tips there about how to turn that philosophy and that motivation into day-to-day practices.
Yeah, no, I mean, the data's out there. We can see it. We are reading it. Do not ignore it. And then find your motivation in order for you to avoid being a statistic within all the articles that we are reading. It doesn't sound like we're doing all that well, but it does sound that you're hopeful that we can move in the right direction.
Yeah, we've seen there are plenty of examples out there, and I've given you some in our past conversations about post-traumatic growth, where people, actually take traumatic events and turn them around. So we can do it. The human spirit is tough and resilient. It's just about finding the motivation to do it. Because, when I think of my grandson, that's what gets me up in the morning. That's what gets me out there running, et cetera, et cetera.
Yes, absolutely. And again, it's family, it's mobility, it's clarity of mind, it's your ability to actually be active in your community. I mean, it doesn't have to be one thing, it doesn't have to be 1,000 things, but it can be, whatever works for you tends to be, I think, really important. I don't think that a lot of people even give themselves the opportunity to find a why, right? They're just going through the motions, going to fast food, doing all the things and not sitting down and saying, why do I have to be healthy? How would that enhance my life? Do you agree with that?
That's the irony, Sheldon, is that those motivators are right in front of us typically. They're right there. We have the pictures on the dresser. Give it some thought.
Exactly. Give it some thought and take that thought and this data so you can put it all into action. You do this every single time, and bringing us the data was so important today, because I think a lot of people are, okay, you should, but data shows that we have a little bit of work to do, if not a lot of work. And I'm grateful that you shared that with us today. If people want to get in touch with you, if they want to follow, fan, and like you, as I like to say, where do they find that information?
It's right, as it says right over my shoulder, 50 plus men.com. You can find all the articles, the book information, and how to get in touch with me.
Oh, I love it. I promise you, you will not be disappointed. Each and every time that he's on This Is It Network, he provides useful and clear resources to make you feel better and live a better life. So thank you so much for joining me.
Thank you. Enjoyed it.
Of course. Okay, guys, get in touch with my dear friend. Again, you will not be disappointed. From all of us here at This Is It TV, I'm Sheldon Bartlett Rumor, and we will see you soon. Take care.